Hi everyone, thank you for having us today. I'm Kathy Gracie. I am the Associate Director for Atlantic Canada.
My name is Osayi Ogeva and the Manager for Diversity, Equity and Inclusion.
My name is She. I'm a registered nurse and trainer with CBS here in Dartmouth.
So I'm going to start, and I'm just going to give a little bit of history of what is Canadian Blood Services. So we are a national, independent, non-for-profit charitable organization, and we were founded in 1998. Our mission at Canadian Blood Services operates Canada's blood supply in a manner that gains the trust, commitment, and confidence of all Canadians by providing a safe, secure, cost-effective, affordable, and accessible supply of quality blood products, and their alternatives. And our brand is who we are. It's a process that involves both the head and the heart, a way to improve efficiencies while preserving the care and compassion that we all share. And throughout this presentation, I am going to talk about the head, which is basically the science behind Canadian Blood Services, and Osayi is going to talk about the heart, the compassion behind what we do, and really why we do what we do. So what we do matters. In Canadian Blood Services, we have an umbrella, and under our umbrella, we have Blood for Life, which we're going to speak about, Plasma for Life, Stem Cells for Life, and Organs and Tissues. So all four fall under our umbrella, and each and every one of them is just as much as important. So blood is, we test and collect blood daily here at Canadian Blood Services, as well as plasma. So for blood, we have blood that falls under platelets and blood, and then plasma is another one that we collect, and it's very important, and you're going to see more designated plasma sites that are starting up over Canada. And basically what we want to do is to be able to be self-sufficient in Canada to provide our own plasma. Stem cells is also very important, and we're going to touch on that a little bit further and how that ties into sickle cell and why it's important that we need more diversity in our stem cell program. So let's talk some facts about blood. What is blood? So blood is a liquid tissue pumped through the body by the heart through thousands of kilometers of blood vessels. It delivers oxygen, minerals, hormones, nutrients, and other important material to the organs and helps clear the body of waste. And the picture of the person sitting in the chair is myself, and I am a very proud blood donor. Every time I donate and I leave feeling very proud that I know I just saved a life. And one thing that we do want to mention is that there is no substitute for human blood. So some facts about blood. Sure. Some facts about whole blood. So our blood is made up of red blood cells, white blood cells, platelets, and plasma. And you will hear us talk a lot today about whole blood, which is our red blood cells, platelets, and plasma, and why they are important and what we use them for. So red blood cells have two main functions. One is to pick up oxygen from the lungs and deliver it to the tissues. Second is to pick up carbon dioxide from the tissues and unload it into the lungs. So white blood cells is your immune system, and that ties into when we talk about stem cells and bone marrow. So that goes hand in hand along with your platelets. So platelets is to react to bleeding from blood vessels, injuries by clumping, thereby initiating a blood clot. In plasma, the main role of plasma is to take nutrients, hormones, and proteins to parts of the body that need it. Cells also put their waste products into the plasma. So all types of our blood cells are produced by our bone marrow. So remember that when we talk about bone marrow, because that's going to be important when we talk again about stem cells. And our bone marrow is our body's factory for producing blood cells. So uses for blood, platelets, and plasma. So that's the science behind it. Now let's talk about what we use them for. So red blood cells are used in emergencies, during surgeries, and to help people having cancer treatments. And one thing with blood is that it does have a shelf life. So it expires. It has a 42-day shelf life. White blood cells, as I mentioned, is your immune system, so it fights infection. Platelets are used to treat people with bleeding disorders, cancer patients, and one thing with platelets is their shelf life is only 5 days. So that's why it's important that we're constantly collecting platelets. And plasma is used to treat people undergoing extensive surgeries, trauma patients, and patients with liver failure. And the good thing with plasma is we can freeze plasma. So that has a shelf life of a year. So why you donate, reason number one. We're going to go through a few reasons why it's important to donate. So the first one is Canadian Blood Services are committed to ensuring a sustainable national transfusion and transplantation system that ensures the safety and sufficiency of Canada's blood and plasma supplies. So we recognize that our future requires significantly more diverse donors and registrants based in order to meet complex, evolving, and underserved patients' needs. So why most patients in Canada who need a transfusion can be helped safely with blood that simply matches their ABO blood type. Some patients with unique antigen combinations, which is the protein on your blood cells, need to be matched with suitable donors with the same antigen combination. So, suitable donors usually come from similar ethnic backgrounds, which is very important, and which is why it is important for people from diverse backgrounds to become blood donors. Every day, patients need blood from donors whose blood type match their own. Canadian Blood Services encourages people of all ethnic backgrounds to donate to help meet the needs of patients. So remember that. So we're going to talk about this a lot. The blood that we have to provide for some people and for some diseases need to come from their same ethnic background.
My parents had 5 children. 4 of us were diagnosed with sickle cell disease, 2 of whom have now passed away. My name is Ulysse Guerrier. I was diagnosed with sickle cell S-beta thalassemia at the age of 2. I have received blood transfusion as a treatment every 4 weeks since I was 10. My genetic makeup as a black person is different than people from other ethnicities. This means that the blood matching process is easier for me and other sickle cell patients when the donors share the same ethnic background. Myself and thousands of other Canadians battling this disease needs your help and support to continue through life with fewer blood transfusion complications. Without the support of blood donors like you, I would not be here today. Book your appointment today at blood.ca.
So I just want to quickly talk to us about other reasons why we should donate. So we just saw the video about Ulysse, who lives with sickle cell disease and thalassemia. But the second reason is also about sickle cell as well. And this is because people who have sickle cell disease require constant blood transfusions and also stem cell transplants in order for them to survive. And we all know, many of us who are Nigerians are very familiar with the knowledge of sickle cell disease. Maybe we have friends or family members who have lived experiences. So I'm just going to show us a video, and this was done by our colleagues in Quebec about the sickle cell disease and what this means for blood donations for the people living with sickle cell disease.
Who here loves winter? Now, who here plays a musical instrument? Who speaks Wolof? Who here listens to country music? Who here has ever been camping? Oh, wow. And now, who here has ever donated blood? My name is Ilanit. I'm 18 years old, and all of you here have saved my life. I was born with sickle cell anemia, and every year I need blood from 130 people from my community to continue to live. To each and every one of you, thank you.
So as we can see from that video, it actually takes 130 people, people who share the same ethnic background with someone living with sickle cell disease, to donate blood for one person to survive every year. And I just want to quickly show us another reason why we should donate. And this is, I want to quickly share this story. So this story here is about Ufoma. This is one of the people that Canadian Blood Services had supported way back. And Ufoma had sickle cell disease. She knew that her maternal aunt in Nigeria had passed away from sickle cell disease at a young age. And when she was 17, the doctors then presented her with the option to have a stem cell transplant. Ufoma has two younger siblings, and her younger sister, who was 11 years old at that time, was 100% match for the stem cell transplant. And so the sister became a stem cell donor. And thanks to the sister, Ufoma had the stem cell transplant, and today she's thriving. So now Ufoma can live her life, you know, just like every one of us. One of the things that she shared is that she's able to go to the gym. She's able to do the things that people do every day without feeling the pains that had been associated with sickle cell disease and she had to live with. And then the third reason why we should donate, this is also because it is a compassionate thing to do. So when we think about the country that many of us now call home, I can say for sure that living here in the last 13 years, I haven't met a group of people that have been as compassionate as, you know, Canadians are when it comes to giving, in terms of resources, in terms of, you know, like donations. People really literally show up all the time. When you go into the donor center, it's never empty. You're seeing people there coming in. People, sometimes I went in one time to the site in Edmonton, and before the doors opened at 9 o'clock, there were literally people lining up outside waiting to donate. That's how compassionate Canadians are when it comes to giving. So I want to share the video of Olise. So this is someone I know personally. We go to the same church in Edmonton. I've known him now, I think, since 2014. And I just really literally want to share his story about his donation with all of you.
My name is Olise Asenwa. I'm a second-year university student taking psychology at the University of Victoria. My younger sister had open heart surgery about 5 or 6 years ago, and in that time, although I was young, I understood like the severity of the matter. And as I got older, I started to understand that if she wasn't able to receive the blood or the right blood in that moment, it would have been catastrophic. So in that moment, I feel like as someone who has O negative blood, I learned I can give blood to anyone, and that could have been my sister or could be someone else's sister. I was 17 at the time, and I expected it to be like way more painful, like way more like dramatic, but it really wasn't. I walked in very nervous because I'm very anxious when it comes to needles, but as soon as I walked in, the nurses were very welcoming and like even like, oh, you're okay, like how are you so tall and you're scared of needles? It was kind of like, it's a joke about it and like brush it off, but they were very welcoming of the idea of me donating blood and like kind of like, oh, advocate more, like this is really good for the community too. In Nigeria, it's kind of like any like fluids or like anything like liquefied, it's not really like something you talk about much or like bring up. It's kind of like there's a lot of myths behind it, so you kind of grow up with the idea like if anyone asks for anything other than physical thing you can make, don't give it to them. Previous to my first donation, it was kind of like also scared, also with the scare of needles, like the idea of like my blood could be used for something bad was also like a daunting thing. But after like literally seeing my blood in a bag and explaining the entire process, it was kind of like, okay, that makes sense. Me and my mom have the same blood type, so we're both O negative, and I always, as soon as I gave the blood, I was like, okay, you have to come, like we have this blood for a reason. And she's always scared. She's always like, oh, I don't know what they're doing. It's like, I don't know like what happens after. And it's kind of like that same like stigma. Like she fears the fact that she can't see what's going on behind the scenes. But with education and like, if she just goes and does it, she can even talk to the people doing it. So in that kind of scenario, it's like kind of my mom's scared like I was, but I've been someone who's turned like 180 and she can do the same. I wish people knew how easy the process is. It's not a daunting experience. It's not a scary thing to just go in and donate blood. I feel like it's kind of daunting because no one really sees it, and there's not cameras filming the entire experience, so people don't really know the true experience of it. But if you just go in and ask questions, most of the time nurses I've spoken to are very open to even answering questions. Even if you're not doing it, they'll talk to you about it. They'll tell you tell you the exact process, tell you everything about it. And even when they're checking your hemoglobin, they'll explain what they're doing before the fact. I feel like what made me really want to get into blood donation is just thinking about my sister. That could have been, if she didn't have the right blood, if she didn't have the blood in general, who's to say what would have known would happen to her? But it could be your sister, it could be anyone else's sister. And in that scenario, you could be saving a life, and just God gave you that kind of blood. I mean, why not use it?
Thank you very much. So as you can see, Olise's reason for donating was because he witnessed his sister. She was really young. I remember when this happened. This was either late 2014 or 2015. She was really young when she needed open heart surgery, and he witnessed her receiving all of those blood donations in order for her to survive, and that was what literally prompted Olise. So the moment Olise turned 17, he actually started donating, and he's one of our regular donors from our community. And so one thing I want to bring to our awareness is that people who identify as Africans, in particular African, Black, Caribbean people, we only make up less than 1% of our active whole blood donor base. So as of June 2022, there were 2,443 active whole blood donors who have self-identified as being Black. And just like Kathy had mentioned, the piece around the red blood types and the importance of that match when it comes to our blood types for our communities is really, really important. So when the donor base is low, you can see how it impacts those from our community that are relying on these donations in order to survive. So Kathy is going to talk to us about the stem cell program.
So I'm going to take some time now just to talk about stem cells. So we talked about whole blood and blood donations. Another thing that we do as well on Canadian Blood Services is stem cells. So specifically, blood stem cells are immature cells that can develop into any cell present in the bloodstream. Without stem cells, the body cannot make the blood cells needed for the immune system to function. When patients need a stem cell transplant, it means that their bone marrow, which we talked about earlier, has failed due to an illness. Patients who undergo chemotherapy or radiation treatments may also need a transplant of healthy stem cells to help heal and reboost their immune system. So stem cell transplants are used for treating over 80 diseases and disorders such as leukemia, lymphoma, sickle cell disease, immune systems, just to name a few. And so there's a little bit of misconception about stem cells. So we're just going to take a little bit of time to tell you how it works, how we would get your stem cells, and it's a very easy process. So first off, in order to get on the registry, it's very simple. It's just a cheek swab. We literally take a big Q-tip and we swab the insides of your cheeks. You send it back to us, and then we enter you into the registry. We do look for people aged 17 to 35 to swab. It's only in that age group that we do accept the swabs from. And then you go into the registry. If you are a match, at that point in time, you'll get a call, and the question is, would you like to continue? Then at that time, you will go get a physical and see the doctor and decide if you are able to actually donate your stem cells. Now, if you are a match, that means that there's somebody that is depending on you to save their life, because this is their last chance of survival. So we do take stem cells in two ways. So we take it, spherical blood stem cells, which is just like a blood donation, just as if any other plasma donation or platelets. The blood comes out through the needle, we spin it, we take your stem cells, and then your blood goes back in. And we do that 80% of the time. 20% of the time is we go through the bone marrow. And that's through the back, the pelvic bone, your pelvic bone. You will be put under with an anesthesia, and you wake up with a sore back for a few days. But again, we only do that in the cases where it's extreme and we need to take it that way.
Thank you. So I wanted to, because I literally put, collected so many stories from people from our community that have had, outcomes, either because positive outcomes, either because of donations, or negative outcomes because of the lack of donation. And sadly, this is, one of such stories. So Miss Rose here, she was a single mom in Toronto that had 3 children. She was also a healthcare worker. And she got diagnosed with cancer for the second time in 4 years. So she had leukemia, and she literally, had to start, living on blood thinners and spending weeks in treatment. And at some point, Miss Rose needed bone marrow transplant. She needed a stem cell transplant. And because of the lack of donor diversity, so the people who actually sign up to donate stem cells in our registry, because of the lack of a match, she sadly passed away on December 18, 2020, leaving behind her 3 children and her mom. One thing I want to talk to us about is the stem cell registry. So Kathy had provided what stem cell is all about, but the registry, the stem cell registry, is really important for it to be as diverse as Canada is. So when we think about the diversity in Canada, it's beginning to rise with lots of immigration and birth rates. When we look at the stem cell registry that we have right now, 67% of the people in our stem cell registry are white. The remaining 33% are made up of Indigenous, Asian, Black, South Asian, Hispanic, and mixed race backgrounds. So less than 1%, less than 1%, same thing with the whole blood donor base, less than 1% of our stem cell registry are made up of people of African descent. So I'm just going to give us the numbers here. So in total, we have 439,906 people in our stem cell registry. Out of these 439,906 people, only 1,810 are Africans. That is way, way less than 1%. And the interesting thing about the stem cell registry and the stem cell match is that you're more likely to find a match within your ethnic background than within your family. So 75% of the time, you're literally relying on a stranger who shares the same ethnic background as yourself. 25% of the time, you can find a match within your family, but 75% of the time, you find a match in your ethnic background, from someone who shares the same ethnicity as you. So like we said here, you have a greater chance to find a match from a complete stranger within your own ethnic community. So it's really important for the donor and patient when it comes to stem cell, just like the blood, it's really, really important for the donor and the patient to actually have the same ethnic background because of the rare blood types. So it's important that we also have more diversity in our stem cell registry. So I just want to talk about Ezra, because Ezra's passing, it really, really hurt me. He passed away the week of my birthday, and this was last month. So Ezra was diagnosed with a rare form of leukemia in 2021. He was really, really young, and his dad had done everything. Of course, many times family members step up, but like I said, it's easier to find a match within your ethnic community than within your family, because not every member of your family is always a match. But in this case, his father was a partial match, and the father stepped up to donate. But because it was a partial match, Ezra relapsed, and the cancer came back. And, lots of swab for Ezra drives were done across Canada. Like I said, the lack of diversity in our donor base, in our stem cell registry, really, came into play here. So the father had done lots of, swab for Ezra drives across Canada. Sadly, Ezra passed away in September last month. He was only 2 years old. So these are some of the reasons, the impact on our community when many of us don't step up to be part of, initiatives that can save the lives of, people who look like us and identify as us as well.
So we're just going to talk now a little bit of still stem cells, but just to move it to the cord blood side of it. So the blood that's left in the umbilical cord or in placenta after baby is born is rich with life-saving blood cells. So Canadian Blood Services Cord Blood Bank collects and stores this cord blood for future use by anyone in need of a stem cell transplant. Collection happens after the safe delivery of a baby and placenta, so it does not interfere with the process of labor or birth, but unless mother opts to preserve cord blood for patients or research, it's normally discarded as medical waste. So like stem cells found in bone marrow or circulating blood, those found in cord blood can also be used to treat more than 80 blood cancers and disorders, but stem cells from cord blood have several unique advantages over those collected from bone marrow and circulating blood. They are collected in advance, stored, and ready for use immediately. So that is a big difference with cord blood. That means it's a shorter wait time for those people who really need that stem cell transplant. We already have it on hand. It's healthy cells and they're ready to go.
So, like I said, I went and I pulled up all the stories for all of us. So this is Nkem, and Nkem is in Toronto area with her mom, and she also works in the healthcare industry. So Nkem did sign up, to be a cord blood donor. So she literally donated her baby's umbilical cord blood, because that's one of the places we could also get stem cells from. And like she said, she was driven by her desire to pay it forward. And this is because she understands the need for stem cells from donors of mixed ethnic backgrounds. And when you think about, the more genetically diverse someone's background is, the more difficult it can be for them to find a matching stem cell donor. So just like Kathy, I did not sign up to be a whole blood donor. I signed up to be a plasma donor. But I've been anemic for some time now, so I'm being deferred to make sure I'm taking my iron pills, and then when I boost that, I can begin to donate. But I remember when I was pregnant with my son, one of the things I was asked if I would like to donate, the cord blood, and I signed up for it. So I ended up giving birth in a smaller hospital, and I don't think that happened because they couldn't use that in the smaller hospital. But those are one of the questions, or one of the things that many of us who are pregnant can talk to our physicians about, to know if the hospital we're going to deliver can use the cord blood, or they can donate the cord blood for that purpose.
So now we're going to switch gears and we're going to talk about eligibility. So for each program, whether it's blood, platelets, or plasma, donors must be a minimum of 17 years. And they have to weigh 110 pounds. When you're in that 17 to 21 age group, you need to be 110 pounds. Now, one thing, there is no maximum age. There used to be, but that's gone to the wayside now. As long as you're healthy, you can donate. Stem cells between the age of 17 and 35, and you need to be in good health. And just if anyone is interested to see if they are eligible, we do have a website. It's blood.ca, and it's right here. So you can go on, and there's a lot of stuff. There's Blood for Life, plasma, stem cells, organs, and tissues. And you can see there's a Am I Eligible? You can click on it. You can see down, there's the little red chat box on the right-hand side. You can click there and ask any questions. There's a registered nurse there who can answer those questions. Or you can call 1-888-2-DONATE. And we always have a registered nurse that can answer any questions if you're not sure. So now I'd like to take a few minutes to discuss deferrals that directly impact your community, and that's malaria. So donors who have traveled to malaria risk areas in the last 12 months must wait 1 year after returning to Canada. And if you've had malaria, regardless of your ethnic background or race, you will be unable to donate blood or platelets. But you are still able to donate plasma, stem cells, and organs and tissues. So we won't focus too much on what you can't, but we will continue to talk about what you can donate. So malaria questions that we get a lot is, why is there a deferral for malaria? So the parasite that causes malaria can lie dormant in red blood cells long after someone has recovered from the disease. So this means that no matter how much time has passed, there remains a small but significant risk that they may still carry the malaria parasite in their red blood cells and platelets. For this reason, people who have malaria are not eligible to donate at this time. There is a way to join Canada's Lifeline and make a difference for patients. For example, people who have had malaria in the past can donate plasma 6 months after you recover. And this is because the process we use to manufacture medicines for plasma. It's fractionation of the plasma, and that eliminates the parasite that causes the malaria, and it's the only way. So the blood and the platelets is fresh. We can fractionate the plasma and make it into medicine that is life-saving for many people. So why can't we test for malaria? And that's a good question. And unfortunately, right now, there's not suitable approved tests in Canada to screen blood donors for malaria. In the absence of an available test, we rely on thorough donor screening and health assessments to protect the blood system. So right now, if you've had malaria, you're unable to donate, but that doesn't mean that we won't get more advanced, because we're always changing, we're always advancing in our technology. That doesn't mean that down the road you won't be able to, and we're hoping that someday anyone can as well. So keep that in mind. We're constantly changing. And one of the things that we're always trying to do is to make sure the blood products that we collect help the patients that need it. So there's a lot of times that people may get deferred because we need to protect our patients, and there's other times you may get deferred if you have low iron, for example, and that's to protect you. So ask those questions if you do go in and donate for plasma or platelets or whole blood, and you get deferred, ask the questions why and what you can do to maybe donate again in the past. For example, if your iron is low, you may not be able to donate now, but eating rich iron foods or iron supplements, you can try again in 3 months. I myself, for example, I used to travel a lot prior to COVID, and I was constantly deferred because I was in those malaria risk areas, but I've been able to donate since COVID hit, because I wasn't traveling anywhere. So again, the uses for blood. Keep in mind, don't get discouraged if you can't donate whole blood. We have so much more that we need than whole blood. Plasma is very important, and we need a lot of plasma. So stem cells, as we talked about in much detail, and how stem cell transplants save lives and how important they are. We have what we call a campaign in a box. So we literally send you a box of stem cells, swabs, and it's very easy. You follow the instructions, you swab your cheeks, you fill out the information, you send it back to us, and boom, you're on the registry. That's how easy it is. So, and if you are interested in doing that, we highly do recommend it. We can definitely set you up with some boxes. And ways to donate, just again, we'll tie it all back in together. So there are many ways to join Canada's Lifeline and make all the difference. So if you never donated before, please book an appointment. We do need donors. Whole blood, plasma, and platelet donations are critical for saving lives. Donors can also join, as I said, our stem cell registry, or register their intent to be an organ or tissue donor. There is an entire community of patients across the country in need of stem cells and organs and tissue transplants. There's so many people looking for a stem cell transplant, and so many people do not find their match. 1,000 people in Canada are waiting for an unrelated stem cell donor, and 4,000 people in Canada are waiting for an organ transplant. You can also make a financial contribution if you would like. And another really good way to join Canada's Lifeline is to sign up to be a volunteer. We're always looking for volunteers in our clinics to help out. And we're going to end today with a video that, anyone who joins Canada's Lifeline, you really do make all the difference. Whether you are an employee, a donor, a volunteer, together we make a difference.
Life is made up of connections. They can be made across a table or a country. They can last a moment or a lifetime, reach one person or many. Life's most powerful connections are not accidental. They're made by giving something of ourselves, our time, knowledge, compassion, even a life-saving donation. This collective purpose is what makes us Canada's Lifeline. Employees, volunteers, donors, and recipients, each dedicated to forming the greatest of all connections, a human connection. This connection has the power to change more than just one life. It creates ripples, the impact of which is felt by families, communities, even an entire country. An impact that can inspire someone to pursue their passion or give strength to a family. empower a champion of their community, or a national hero. An impact so great, it could even change the world. As Canada's Lifeline, we all offer a part of ourselves, building and expanding these most powerful human connections. In doing so, we prove that together, we don't just make a difference, we make all the difference.
See the celebration link for more information for the 2022 Nigerian Festival Week, powered by the Association of Nigerians in Nova Scotia.